Hello everybody, Serene Hovanisan here, and I am going to talk about childhood obesity in Hispanic population. Hispanic or Latino population is one of the largest and fastest growing ethnic minority groups in the United States. And according to the U.S. Census Bureau 2014 report, Hispanics constitute 16.7% of U.S. population, which is estimated at 55 million. Top 3 mortality causes in Hispanic adults. As of 2013 reports, the average life expectancy at birth of a person of Hispanic origin was 78.8 years. And the top 3 mortality causes for adults are cancer, heart disease, accidents, followed by cerebrovascular disease and diabetes. The top 2 causes are accounted for the 46.1% of deaths. 42% of Latino adults are obese, which is 10.6% more than that of whites. And being overweight and obesity are not only health concerns in the U.S., but they have also become an international concern. In the world's adult population, almost 1 in 10 is obese. Obesity is associated with a variety of other serious health risks such as cardiovascular disease, hypertension, type 2 diabetes, and increased risk of cancer. This is a concerning public health issue because each year more than 400,000 deaths and 117 billion in healthcare related costs are attributed to obesity. Hispanic childhood obesity is a huge concern because it is worth noting that by 2030 almost 1 in 3 children will be Hispanic in the U.S. and the children who are overweight in their earlier years have up to 70% chance of becoming overweight as adults. There are several contributing factors to the high prevalence of childhood obesity in Hispanic communities. So I'm going to briefly talk about 3 of them. The low socioeconomic status. The childhood obesity prevalence for children below the poverty level was 27.4%, and this is 2.7 times higher than the prevalence for children with family income exceeding 400% of the poverty level. And according to some reports, Hispanics were more than twice likely to be poor than non-Hispanic whites. Also, living in a low-income household can indicate that the child's family resides in a poor neighborhood that lacks sufficient access to healthy food and fresh produce. And as we know, the food deserts. And a study shows that there is a great disparity to access to fresh groceries in low income neighborhoods. Also, as we can see, there is a lack of parks in Hispanic neighborhoods. Although there hasn't been shown a significant difference in the number of for-fee recreational facilities, there is a great lack of resources such as parks, trails, and playgrounds in low and medium socioeconomic communities. And we should note that the availability of parks within the community is associated with an increase in physical activity participation, especially for children. So everybody likes a little chubby baby with big cheeks. However, in some cultures, actually, being a little overweight indicates that the person is well nourished and healthy. So some mothers can be very concerned that their children might be undernourished, and this can lead to overfeeding the children or not paying attention to their child's healthy diet. So these issues, are going to be discussed, some cultural issues that prevail in Hispanic mothers specifically. Infant overfeeding is very common in Hispanic mothers, and they usually associate the increase in the body weight of an infant with a sign of good health, and they have a difficulty recognizing obesity in their children. That's why they most of the Hispanic mothers combine breast milk and formula in the as on a daily basis, beginning at the first week of the child's life. Another contributing factor to obesity in Hispanic children is the inclination to introduce infant to solid foods before age of 4, and the recommended age to introduce a infant to solid foods is 6 months. Also, there's an interesting fact that African Americans and Hispanics are significantly less likely to self-report obesity and associated health risks. And when the prevalence of obesity is high within an ethnic group, the members of that group may be less likely to recognize their own obesity. And this can be applied to mothers as well, who do not recognize that their children are being overweight. And also, given that Hispanics usually live in a big family, sometimes the parents and their extended families can become the main advisors in child raising, and they also can kind of push the mother to overfeed the child because the child doesn't look chubby, which means the child is not healthy. Some of the programs that actually one of the programs that I want to talk about is the People on the Move, which is the California local evidence-based program that targets the issue of obesity in Hispanic communities. And it is managed by the California Center for Public Health Advocacy. POTM advocates policies related to nutrition and physical activity, system change, and neighborhood change in Hispanic, specifically Hispanic communities. So what I have here is a chart of the adult smoking, and as it shows, there is a significant decrease in the smoking rates in adults in the U.S. During the past few decades. And why I decided to put it here, this is a huge success that our nation had in battling a public health issue. And what I think is that government has to have more active involvement in fighting the childhood obesity, and I think that very strict and diligent interventions and public policies, campaigns and regulations are going to have an undeniable success in fighting the childhood obesity. As we can see with the example of smoking, it is possible to achieve this kind of success rate, I think the multi-level interventions that need to be implemented to achieve success in this case need to be addressed not only to the community that is suffering from the disparities, but also need to be addressed to the establishments such as big food companies. So just like with smoking example we see here, there are many unhealthy types of foods that provide limited nutrition to children, yet they're very high in carbs and sugars. So the government should make more healthier alternatives for snacking available for children, and limit the sale and advertisement of unhealthy foods to children. So I went a little above my time. So thank you so much. I was very nervous, and this was my 5th try, I think. But thank you, and good luck, everybody.